Good afternoon, everyone. Just starting a couple of minutes early just to introduce ourselves and do some welcomes and introductions. Please feel free to keep your cameras off and your microphones off if that makes you feel comfortable, but do switch them on if you're happy to share. And if you don't mind, that we'll be recording today's session. So I'm Dr. Timea Suli. I'm at the University of Oxford. I work for the Research and Surveillance Centre, which I'll be telling you all about. Great. So to get started, what is the Research and Surveillance Centre? We've got this nice image on the right here that shows you the distribution of RSC practices across England and Wales. We're expanding into the 4 nations now, which is very exciting. See if you can find yourself on that map and see if you have good representation there. If not, it can always be interesting to get you on board. So we're one of Europe's oldest sentinel systems. We have over 2,000 practices. I think we're around 2,033 practices in the network from Monday morning, and that represents a good 32% of the English national population. So that's patients across the country. So it's a good 1/3. The work we do contributes very closely to UK Health Security Agency, previously Public Health England. And we were a real big contributor during the pandemic and have since continued working very closely with them. Joining the network means that not only are you a member and you contribute very important data to us, you also have the opportunity to take part in paid research opportunities, and that's what I'll be walking you through today. Some of you who met me at the Better Practice conference maybe know a little bit about this, as I'm always big on pitching it, as I think it's really exciting and a really nice gateway into research at your practice. But I'll be getting into surveillance shortly. So let's look at the data. So the data that we gather is used by UK HSA to inform public health policy. We provide a weekly report to all our member practices. This monitors around 37 conditions, and it's nice that the codes that you enter into your clinical system are used to build a picture of what's happening across the country, and this is used to measure background population immunity and vaccine effectiveness alongside the sampling data. This graph on the right here is pulled from our weekly report, and it shows exacerbations of chronic lung disease. I've spoken with some practices who've told me that they often find keeping an eye on trends across weeks can be really helpful in informing their patients, especially with acute respiratory infections and reducing unnecessary antibiotic prescribing. Sometimes just having this data can be quite empowering in your everyday practice. So one of our biggest campaigns is Sampling is Informing, and this is the idea that the samples you take, the biological samples or virological samples that you take from your patients, can really help build a picture of what's happening and what acute respiratory infections are spreading across the country. On the right-hand side here, we have a bubble map, and this shows our swabbers across the country. As you saw, the big map is the data contributed, the pseudonymized patient data. Here we're looking at the biological sampling and the contributions made by practices. Again, see if you can find yourself on the map and have a think if you're coming from a big swabbing region, or if we could get more from you. One of my biggest campaigns in the last couple of years has really been expanding in the west of England, the southwest, and in the east of England. So hello to anyone in those regions on the call today. So what is virology sampling? So it provides critical information on which respiratory viruses are circulating. It has a couple of levels or layers, I suppose. Nationally, the data is used by UK HSA to measure vaccine effectiveness, and it really helps us helps the NHS with planning for cold and flu season. Internationally, we also provide data to the World Health Organization, and this is used for global strain selection meetings. And here bullet pointed are the viruses that that we test for. And highlighted in bold are infections that we can report results directly back to your practice on. So if your patient presents at practice with any of these infections, we'll be able to let you know via our UK HSA labs that they have these infections. So how do you get virological samples from your patients? So for eligibility, any patient who presents at your practice with symptoms of cold and flu or acute respiratory infection, we like to say any sex, any age, as long as they have cold and flu symptoms, they're welcome to take part. You will need to give them verbal consent, take verbal consents, apologies, just admit this person, which reduces some of the workload usually involved in taking part in research, and offer them a patient information leaflet. And we ask that swabs are taken within 10 days of onset, because that allows the lab to test them properly. Sometimes you'll see this bullet point about sampling all ages. Sometimes, depending on the season or what's been spreading or what spikes we may have noticed across the country, we may ask different groups to be swabbed more. So if you're able to contribute those, that's wonderful. But we're really just happy with any RE acute respiratory infection samples. We offer 2 pathways, and this is to make life as easy as possible for you in your busy clinical days. So we have the in-practice kits and forms. These are materials that you order directly from us via this link. They should be dispatched to you and arrive the next working day if you order by 12:30 p.m. This contains a couple of things, as you can see in these photos. You have a paid postage envelope. These all fit inside your local postbox slot, so they're very easy to send off. It contains a carrier tube and a swab for you to take a nose and throat swab from your patient. And the practice receives £12.50 payments that presently we make payments on a quarterly basis. We can discuss that if you're interested. So that's one pathway. The patient will come to the practice, you take the swab, and you post it off at the end of the day. The other option is, depending on whether you want to do it via triage, or also they come into practice, but you think, okay, this is a good instance of a person who'd be quite good at swabbing at home. You would refer them to the Take a Test service. Here, the patient would enter in a voucher code, which would be your ODS code. The kit gets delivered directly to their home. They self-swab at home, and similarly, like with the mailing kit on the left-hand side, the patient will post it off and they will get results, in this instance via text message. In both instances, the practice receives results directly at the practice. So a second big campaign, and I always like to say that codes are just as important as swabs. The codes that you put into your clinical systems help us build a really, really rich picture of what's happening across the country. So I shan't spend too much time on it, but I do like to bring up this visual. So the clinicians on our team, in our research team, have come up with a hierarchy for acute respiratory infection. And these codes in these boxes on the left-hand side, every time you enter infection, influenza-like infection, exacerbation of a specific condition, these codes that you take the time to put into your clinical system help us build up a picture of RE and the spread of RE. And we're able to connect the codes with the biological samples, which is really nice, really nifty, and it gives us fuller data. We also ask if you're able to code the likely diagnosis and vaccinations and key symptoms. We offer data quality payments for high quality coding, and dare I mention that one of our practices was given a lovely £950 for their efforts in coding last year, which I always think is a nice thank you for good quality coding. So a perk of being in the network is the dashboard. I think it's a really nice feature. A lot of our practices really like using it. It's personalised to you. So if you look up at this top left-hand corner where the arrow is, we will give you a unique identifier code. And you can see what happens both nationally, regionally, and in your practice. So you can play around with the dashboard. If you already have RSC membership, I can supply you with your codes at the end if you like, if you want to have a play and see how it works. But it's a really, really nice feature, and it again allows a more personalised approach to your contributions to the RSC. The second arm of our surveillance is serology sampling. Presently, we do it only in under 18s. And I'm mindful that not all practices have capacity for sampling in under 18s, but if you do have capacity, it can be a nice way to get involved. We pay £30 for samples in under 8s, that's for each sample in under 8s. And someone please correct me if I'm wrong, I believe it's £11.50 for ages 9 to 17. So the payments are for the young group slightly higher, that's to reflect a kind of urgency, I suppose, in needing them. These are also used to monitor vaccine efficacy in communities. If you have capacity or are interested in this, please let us know. Primarily, we're recruiting for virology sampling and joining the network for data contributions, but of course, we're always happy to have people join serology too. So I'm just going to start summarising now, just to give a bird's eye view of what we've been talking about. So what is it that ORCID, that's our hub where the data goes into, what is it made up of? So the routine patient data from RSC practices, the codes that I've been describing to you. Then we have the virology samples and serology samples. If you were to take part in that, that is also fed in. And finally, linked data from NHS Digital. This pulls in very interesting things like secondary data and is able to connect different sources. And this builds up the ORCID hub. I just would like to say that all data is pseudonymized and de-identified at the practice. So we never pull in anything that isn't de-identified or pseudonymized. I have my colleague on the call here who's happy to answer any more specific questions on that. Now, the results from the data hub are used to build up these pictures that I've been describing, the weekly reports, disease surveillance for UKHSA, and finally, journal articles, research. I'll be happy to share any of our research outputs. We have plenty of them. We're very, very busy bees. Now, I suppose the final perk I'd like to bring up is our Practice Liaison Team. I'm there very airbrushed in the top left-hand corner, but this is my team, Tamea Suli, Ava, Ash, Lizzie, Elia, Jack, Jess and Karen. We are all on hand to offer, I suppose, what you could call customer service. We're here to support you throughout your research projects. We're here to answer questions. We're here to train your teams in person and online. And it's really nice to get involved in a project where you have 8 individuals who are more than happy to help you. Great. I believe that's the end of it. So thank you everyone for listening. As a reminder, I'm Tamea. The email is there. We'll put this into the chat. I'll put the link into the chat too. I'm going to pause, give you all a breather and a break from me, and give you an opportunity to put some questions in. I can't see the chat, unfortunately, because I've been speaking, but I'll just have a look now and see if we have any questions. If you'd like to leave, that's also great. Thank you for attending. We're really grateful that you took your time out today to be with us. We'd love to hear from you. I'm not quite sure what the status, who's joined the network, who hasn't joined the network, but please, if you haven't joined the network, drop us an email or go onto this link here. You'll find the relevant resources there, or in the email, just put join RSC and we'll get you signed up as soon as we can. I have a question here. We would potentially like to be involved in swabbing. Who could I contact to discuss this, please? Contact us, Practice Inquiries. I'm going to put that into the chat. I'll put it in a million times so that there's no confusion. So just shoot us an email. In the subject line, you can put whatever you like. You can put joining the network, joining swabbing, and we can get you onboarded. Just to give you a little bit more detail, the process is fairly straightforward. We'd have you for an onboarding call a little bit like this. If you'd like one, we can train up your team. We can come in person and train you up. We're always happy to travel, or we can do an online Teams meeting. And we would do the paperwork behind the scenes to get all the necessary documentation for you. And we would send you a digital one-pack kit that contains all the posters, all the documents, all the patient information leaflets. And this is a nice sort of starter pack, training pack to get you started. Again, we're on hand to walk you through that. Are these adopted on the RRDN portfolio? No, this is because it's surveillance rather than traditional research, but we do have studies that are part of these portfolios. I'm running one at the moment. We're looking for a few practices to get involved. We're looking for practices that have keen pharmacists or really like to think about medication review and their efficacy. That's a project called BrizMed. I'll put that in the chat too. So if you're interested in portfolio studies, we do have some. Question from Mark. Can we do swabs alongside other research studies that involve respiratory infection diagnosis? Absolutely. Yes. That's not mutually exclusive. And again, because it's surveillance, it operates quite differently. One thing I didn't mention during the presentation is that we do this year round. There's no weekly targets you have to hit. You can do as many or as few as you like. You can stop and start. Obviously, we'd like you to be involved as often as you can because it helps us build a really rich picture of what's happening. But if you find that over the summer season things are a little bit slow, but you think it's a good opportunity to work on workflows or operations, you may find that that's a really good time to get started. Then you're ready to go, armed and ready for cold and flu season. So we're very flexible. A couple of questions coming through. Oh, the name of the pharmacy study. Thank you, Ashley. That's BrisMed. Please email me directly. I'm going to put myself in the chat. BrisMed, that is a medication review study. We're looking for about 12 practices to take part, and that's also a paid research opportunity. We hope to get on board with IID free. Our apologies. Recruiting for IID free has closed, unfortunately, but it's the third intestinal infectious disease study. And it's possible that we may do a fourth. That's a study with the Food Standards Agency where patients who present with symptoms of infectious intestinal disease provide a stool sample, also a paid project. As you can see, there's lots of fun things going on in the RSC. Sorry, Joe, but I would happily have you for something else, or we'll keep you in the loop for the next IID free or IID study. Apologies. Yes, Elia, please go ahead.
Sorry, Timea. I think there is another question in the Q&A.
Yeah. Could you read it? Could you read it to me?
Yes. From Bernard Clemens. How do you enter details? See and integrated in System 1?
I'm just going to search that in the chat if that's okay, so I can see the question properly. How do I insert details into System 1?
Yes, and there is also another question from Natalia. Any projects in secondary care?
Oh, interesting. Unfortunately, not. I don't know, Natalia, if maybe we met at the conference. That sounds like a familiar query I may have had. Email us, though. We may have something a little bit unusual or outside the box for you. So please email us. We can see if we can connect. How long does training in person take? As long as this call does, or however long you need. We can come up for the whole day. We can come up for an hour. If you're comfortable taking nasopharyngeal swabs, then we're just there to show you how to code, how to post it, and that really doesn't take too much time. I'm saying 30 minutes. Is there a waiting list for training? Absolutely not. No. Please just get in touch on one of the emails in the chat and we can organise it. As I said, there's 8 of us on the team, so we're flexible, we're ready to travel, and we're based in Oxford, so it's quite easy for us to get around the country. If you'd like in-person training, we'd be delighted to come. I always love any excuse to leave the office and come see practices in person. I'm going to draw that to a close. Thank you everyone who joined. Thank you to all my colleagues who supported today. It's really great to see your enthusiasm. It was brilliant to meet you all in person. It was really a pleasure to be at the Better Practice conference. We'll be organising more of these events and we have lots of exciting research opportunities going on. So I'm going to draw it to a close there. Please email us, get in touch, visit our website, put something in the subject line so that we know it's you. And thank you very much for being here today. We're going to be finishing now. Thank you.
Thanks very much, Timea.
Thank you. Bye-bye.
Bye-bye.